Have you ever thought that the pain in your left shoulder, just simple shoulder pain, could actually be an emergency signal from your own heart, warning of an imminent heart attack? It might sound hard to believe, but it's a crucial medical fact that many people don't know. Shoulder pain. It's an incredibly common symptom, seemingly harmless. But hidden behind that familiar discomfort can sometimes be warning messages your body is silently sending. And in many cases, those warnings are related to life-threatening conditions. Right now, we're going to explore the mysteries behind shoulder pain. We won't just stop at the usual musculoskeletal problems. There are three main groups of causes for shoulder pain to consider, and today I want to highlight two particularly important groups that are often forgotten despite being very dangerous. Let's start with the most alarming connection. Number 1. Left shoulder pain can be related to the heart. Why can heart pain show up all the way over in the left shoulder? It's because when the heart muscle is severely lacking oxygen, like during coronary artery disease or a heart attack, pain signals are sent to the brain. What's unique is that some nerve pathways carrying signals from the heart merge with pathways coming from the left shoulder and arm area. Because of this shared wiring, the brain sometimes gets confused, interpreting the pain signal from the heart as a sensation in the left shoulder or radiating down the arm. So, how can you distinguish this left shoulder pain from regular shoulder pain and recognize it as a distress call from your heart? These are the crucial features to watch out for. First, the type of pain. It usually doesn't feel like typical muscle or joint pain, meaning it doesn't get sharp when you move or press on the area. Instead, heart-related pain often feels like deep pressure, tightness, or a squeezing sensation. You might feel it in the left chest radiating to the shoulder, or sometimes just in the left shoulder area itself. Imagine a heavy weight pressing on your shoulder or chest. Very uncomfortable. That's a sign the heart muscle is critically low on oxygen. Second, how the pain spreads. Radiation. This pain rarely stays in one exact spot. It tends to travel or radiate down the inner side of the left arm, closer to the pinky finger. Why there? It follows the path shared by sensory nerves from the heart and arm. Sometimes the pain can also spread up to the neck, lower jaw, feeling like an ache or pain in the jaw, or even to the back, between the shoulder blades. Third, the triggers for the pain. Heart-related pain often appears when factors increase the heart's workload, making it need more oxygen. Specific examples include physical exertion, climbing stairs, walking quickly, heavy lifting, experiencing strong emotions, anger, anxiety, fear, arguments, or sudden exposure to cold, stepping out from a warm house into cold weather. These situations demand more from the heart, and if the coronary arteries are narrowed, they can't supply enough oxygen, causing pain. Fourth, duration and response to rest, crucial for differentiation. If this type of pain occurs with exertion and only lasts for a few minutes, usually less than 10 to 15 minutes, then gradually subsides and disappears completely when you stop and rest, or use prescribed vasodilator medication, it's very likely angina. This is an important warning sign from your heart, indicating underlying issues with its blood supply. Absolute caution. If the pain becomes severe, lasts continuously for longer than 15 to 20 minutes, doesn't get better even with rest, and might be accompanied by shortness of breath, cold sweats, or nausea, this could very well be a heart attack. Don't delay. Call emergency services immediately. Always remember, your cardiovascular health is incredibly important. If you experience left shoulder pain with these suspicious characteristics, go to the hospital to get checked immediately. Tests like an electrocardiogram, ECG, will help clarify the situation. That covers the connection with the heart. Now let's move on to another area that can also surprisingly cause similar pain in the shoulder. 2. Shoulder pain can also be caused by abdominal problems. Surprisingly, problems with organs deep inside your abdomen can trigger pain felt in your shoulder. This is called referred pain. It happens because irritation near your diaphragm, the muscle separating your chest and abdomen, can send signals up the phrenic nerve, a nerve that shares pathways with your shoulder area. Your brain essentially misinterprets the pain's location. For example, issues with the gallbladder or liver under the diaphragm on the right often cause right shoulder pain. Watch out if this pain occurs with nausea, bloating, or indigestion, especially after fatty meals. Less commonly, problems with the pancreas or spleen near the diaphragm on the left can cause left shoulder pain. Be alert if this occurs with severe upper abdominal pain, often radiating to the back. Remember, acute pancreatitis is a dangerous emergency. If your shoulder pain comes with these kinds of digestive or abdominal symptoms, see your primary care doctor or a gastroenterologist to investigate the true source. So, we've gone through two important but less commonly considered causes. Finally, let's look at the group of causes most people experience. 3. Shoulder pain from shoulder joint issues, most common. Finally, let's cover the most frequent cause, problems directly within the shoulder joint itself. This is typically direct pain from local issues like inflammation, tendinitis, bursitis, tears, rotator cuff, stiffness, frozen shoulder, wear and tear, arthritis, or simply strains from overuse or poor posture. Unlike referred pain, this pain is usually felt right where the problem is. For these kinds of issues, consult an orthopedic doctor or a physical therapist. So, what's the key takeaway? Remember, while your shoulder pain might be a simple strain, it could also be a serious warning from your heart or abdomen. The bottom line is, never ignore persistent or severe shoulder pain. Listen to your body. Seek medical attention immediately if your shoulder pain is sudden, severe, or crushing, doesn't improve after several days of home care, comes with other red flag symptoms like chest pain, shortness of breath, severe abdominal pain, nausea, vomiting, fever, or unexplained weight loss. Don't try to diagnose yourself or just wait it out if you have these warning signs. Getting a proper medical evaluation is crucial to identify the cause and get the right treatment quickly. Your health is too important. I truly hope the information about shoulder pain today has been valuable to you. If you found it helpful, please don't hesitate to hit the like button and share this video with your loved ones and friends. You never know, this small action might help someone recognize an important health issue early. And of course, please hit subscribe so you don't miss out on daily healthy living tips and can join the channel on the journey to becoming healthier and living a better quality life. That is precisely the goal we always aim for. Thank you sincerely for your support and for watching. See you in the next video.